Hi. So this video is meant to go over some of the common diseases that we see in dogs. I'm going to primarily go by body system and then talk about some of the infectious diseases that dogs can have. So one of the most common diseases that we see in the musculoskeletal system is something called hip dysplasia. Hip dysplasia means that the hip joint of the dog is abnormal. We see this in a lot of different larger breeds of dogs: German Shepherds, Golden Retrievers, Rottweilers, Dobermans, Labrador Retrievers. A lot of the larger breed dogs can get hip dysplasia. What we will tend to see in these dogs as a clinical sign of hip dysplasia early on is an awkward gait. Some of these are dogs that sit in a way that's crooked, like off to one side instead of sitting straight down on both legs. They'll show up intermittently lame, reluctant to want to jump up into a car or jump up on furniture. The real cause of hip dysplasia is an abnormality of the hip joint. And we diagnose this by taking x-rays of dogs. Normal hips have a ball and socket joint that looks a lot like this. But hips can be abnormal because the leg bone, this ball part of the ball and socket is abnormal, or because the socket part is abnormal. If there's not a nice tight fit of these bones together, then we have abnormality and we can have looseness in the hips and rubbing of bone on bone, which can lead to arthritis and severe pain in these dogs. This is a genetic condition. It's inherited. So if you're buying a purebred dog, it's really important to ask about the genetics of this dog's hips. Have the dogs been checked for hip dysplasia that are the parents of the dog that you're buying? The other thing that helps is exercise. Keeping good muscle tone around those hips is awful helpful. And good nutrition is also important. One of the things that we're starting to believe is that in large breed puppies, if they're not fed properly and the bones and muscles aren't growing at the same rate, it can make the bone problems worse. There are some supplements that you can take that have some anecdotal evidence of having an effect, a protective effect on the joints, but certainly there are supplements that can be taken once hip dysplasia is diagnosed that seems to have a therapeutic effect, meaning if the dog is showing signs of pain in those hips, these medications can help. There are surgical treatments. You can, as you can with people, do a hip replacement in dogs. It's a highly radical surgery that would be done by a veterinary surgeon specialist. Again, medical treatments like anti-inflammatory drugs, dietary supplements like glucosamine can sometimes help with hip dysplasia. Another fairly common bone and joint problem, but is much more common in the dogs I like to call low riders, the long-backed, short-legged dogs, dachshunds, corgis, basset hounds. What happens with these guys is, imagine having a really long coffee table with legs only at the end. The middle is going to get a little bit wobbly. If you try to put pressure on it, it'll tend to be unstable in the middle. So that's sort of how it works with these dogs. They have some instability in the middle of their spine because they have very long backs and very short legs. This is what a normal spinal column looks like. Here are the bones, the vertebrae, and hollowed out in the center is the spinal cord. And in between each vertebrae is this little structure called the intervertebral disc. And if you look at a cross section, it's got a lot of cartilage and sort of a squishy bit inside. It almost acts like a little gel pack that helps to cushion these back spinal bones so they don't rub against each other. But with enough pressure and instability, this material, this disc material, can bulge up and push up against the spinal cord, and that's what causes our spinal cord disease. For these dogs, this is an emergency. They are in a lot of pain. They'll sometimes stand all hunched up like this or just be reluctant to move. Some of them, if the disc material has really pushed hard against that spinal cord, will be either weak or paralyzed in their back legs. For these dogs, you need high doses of cortisone, which is an oral steroid, a lot of rest. Some of them will need surgery to help take the pressure off of the spinal cord and remove that disc material from pressing up against the spinal cord. For dogs where this problem turns into permanent paralysis, that leaves them in a situation where they're going to need essentially a doggy wheelchair called, and there are companies that make these little canine carts. You strap the dog in and they run around just pulling themselves on their front legs. It's not the optimum situation. The other problem with these guys, these long back dogs, is if they get to be overweight, which is a big problem in dogs and in cats these days, it makes the tendency of this to happen even worse. Again, nutrition, super, super important. The third of the bone and joint diseases I want to talk about is an ACL injury, a ruptured cruciate ligament. For those of you who are athletes, you may have heard of people tearing an ACL. This is a common problem in athletic dogs, but also in dogs that are overweight. It's actually a tear of one of the ligaments in the knee. And one of the things that we'll see is the dogs will either carry that leg and not want to put any weight on it, or they'll walk and just touch their little toe down and pull it back up and not really want to bear full weight on that leg. What happens is that these normal ligaments that are supposed to hold the upper leg bone and the lower leg bone together get torn, and so the bones can move back and forth in a way that they shouldn't be able to. A knee should just move like a hinge. Treatment for an ACL injury, sometimes rest can cause that to heal if it's a partial tear. If not, a full tear usually requires some sort of surgical intervention. Skin diseases. These we see all the time in veterinary medicine. A lot of them are allergy. Flea allergy has a really common pattern. It's back here around the tail area, on the back, and sometimes on the belly. This is usually caused by an allergy to the bite of the flea. So a dog doesn't have to have tons of fleas to have a really severe allergy. It can even just have a few. Treatment for flea allergy dermatitis: get rid of the fleas. Use a flea collar, use a spot on flea product, and there are medications that you can give to ease the allergic response. This is a hot spot. This is one of the rare situations where an owner will call and say, "It wasn't there yesterday." And the dog comes in with this huge red painful lesion. That's because a little itch turned into a continuous itch, and the dog was tearing at it all night long or all day while the owner was out. And by the time they get home, it's a mess. This is usually related to a skin allergy. It can be related to insect bites. The best thing to do is get as much of the hair away from this wound as possible, clean it up with a nice antiseptic soap, and put cortisone cream on there. It'll help to cool that off for the dog. They really, once the hair is away, tend to feel a lot better. And I usually give them injections of cortisone to help quiet down the inflammation and the itch, and sometimes even oral antibiotics if it's really irritated and I'm worried about a skin infection. Ear infections, if you have a dog with droopy ears, bulldogs, golden retrievers, Labrador retrievers, any kind of spaniel, this ear canal with this flop down ear, if it gets a little irritated inside, is a great place for an ear infection to happen. The biggest sign that we see are dogs shaking their heads, scratching at their ears, and they smell really bad. The really nasty smell can come from a really infected ear. Again, our signs: head shaking, face rubbing, ear scratching. They have red, itchy ears. And again, for this, the treatment, clean the ears out. Some of these dogs needs to be sedated to clean these ears out because they hurt so bad. Um, Again, cortisone, sometimes antibiotics, sometimes antifungal medications because this can be a yeast infection. I usually like to get a little swab and look at the cells under the microscope to see if I see bacteria or yeast in order to diagnose what's going on in there. Another skin problem, the ever-present anal glands, the dogs that sit down like this one and scoot along the rug. Um, what's really happening is that there are two little glands on either side of their anus that produce a fluid that helps to sort of make it easier for poop to pass out of the anus. It's a nasty smelling stuff, and if these little glands get plugged up, then it's really irritating to the dog. And really, the only way to take care of that is literally to squeeze the fluid out. It's not fun for the dog. It's not fun for the person who has to do it either. If you've got a little teeny tiny breed dog that gets really excited and then starts to have a honking cough, um, that could be caused by collapsing trachea. In toy breed dogs, in little dogs, this is super, super common. The way a normal trachea is shaped in a dog is there's essentially a U ring of cartilage and a little bit of muscle and connective tissue that turns this into a full tube. If this cartilage is a little thinner and weaker, which it can be in smaller dogs, when air is moving in and out of them really, really fast, it will tend to cause the trachea to narrow down. The connective tissue is too flexible. There are some treatments. You can sometimes put dogs on medications to help open up their airways a little bit. In some cases, you need to do surgery to put braces on the tracheal cartilage. But for most of these dogs, I tell them try to make sure you don't let your dog get too fat. And if the dog is getting super overexcited, stop whatever you're doing that stimulated it that much and give the dog a chance to calm down. Kidney disease, another serious problem with dogs. The biggest sign I see of dogs that have kidney disease is what's called PUPD, polyuria and polydipsia, drinking a lot of water and urinating a lot. This is also a sign of two other diseases, diabetes and infection in the uterus. So it becomes really, really important to try and tell all of these things apart by doing blood tests that can tell you what the kidneys are doing, what the liver is doing, what the blood sugar levels are, and sometimes, in addition, x rays. For kidney disease, the treatment is IV fluids. We need to keep these animals hydrated and treat whatever is causing the damage to the kidneys if we can. The other thing that I like to do is a very low protein, low salt diet. It takes a little bit of the stress off of the kidneys. Dogs that have a bladder infection will urinate more frequently and will sometimes strain to urinate or start to have accidents in the house when they never did before. I don't usually see that connected to lots and lots of drinking and a lot of urine production. It's little bits of urine more often because the bladder is so irritated that they just have to go all the time. Often I'll have owners come in and say, my dog's peeing all over the house. I test the urine and I find it's a urinary tract infection. And then the owners feel guilty because they've been punishing the dog for the accidents and all the time not realizing that the dog wasn't feeling well. The best way to check for a bladder infection is to test the urine. Not easy to get a dog to pee into a cup. You can sometimes do that. Sometimes we need to pass a urinary catheter or do what's called cystocentesis, use a needle to get a sample of urine directly from the bladder. Another cause of urinary tract infections can be bladder stones. This is an x-ray of a dog. Here's its backbone. Back legs are extending off this way. Head is in this direction. And right here is the urinary bladder. And all of these bright white spots are actual physical stones in the bladder that come from crystal formation in the urine as a part of a problem with the dog's diet. Often a dietary change can make these go away, but sometimes if the stones are big enough, you actually have to do surgery to remove them from the bladder. Another cause of excessive drinking and urinating is something called a pyometra. We're going to spend a little bit of time when we do what's an emergency later in this week talking about dogs giving birth and dog heat cycles. But if a female dog goes through a heat cycle where she's ready to breed, but she hasn't actually been bred, and then starts acting sick about a week or so after her signs of heat, I worry about pyometra. Dogs will sometimes have a discharge because of the infection, but not always. If it's what we call a closed pyometra, the infection just builds up and there's no discharge. We will sometimes see dogs that are vomiting, lethargic, running fevers, not wanting to eat. A normal dog uterus is this sort of Y shape. Puppies will be able to go into both of these, what are called horns of the uterus. But if the womb is full of pus and bacteria and infected material, this big swollen uterus usually has to be removed surgically, and it is an emergency surgery and can be dangerous for the dog. So I really recommend having this uterus removed, spaying and neutering a dog if it's not going to be used for breeding. Heart failure is another problem that I see in a lot of different breeds of dogs. Miniature poodles, Cavalier King Charles Spaniels, really common. Some of the larger dogs like golden retrievers and boxers have some genetically induced heart problems. Heart problems can be caused because the valves that allow blood to move through the chambers of the heart aren't working properly, or because the heart muscle itself is deteriorating, which is called cardiomyopathy. The only way to completely diagnose heart failure in a dog is X-ray and ultrasound. An X-ray will show you an enlarged heart, a heart that's bigger than it should be in the chest. An ultrasound can show you abnormal, this should say valve, just like a regular lecture with Dr. Kessler, or abnormal muscle. Signs of heart failure: weakness, not wanting to exercise when they used to want to exercise, a fluidy sounding cough, can often be a sign of heart disease in dogs. Really, really, really important to get that checked out if you have a dog that's coughing for a really long time. Heartworm can also be a cause of heart disease in dogs, so testing for dogs that aren't on heartworm preventative is really important as well. In the endocrine system, the hormonal system, hypothyroidism is super common for a lot of different dog breeds. For example, Akitas, Dobermans, Beagles, and Golden Retrievers, but I see hypothyroidism in a lot of different breeds. The signs of this is a dog that's lazy, kind of sluggish. They tend to gain weight super easily. Sometimes they have patchy fur, or chronic skin infections. I start to see that in a young-ish dog, and I will immediately do a blood test to look for low thyroid hormone. Supplementing thyroid hormone, giving them a pill every day, usually takes care of this problem. There are some intestinal diseases that are particularly a problem for dogs. Parvovirus is one. This causes severe foul smelling diarrhea and lots of vomiting. I will tend to see in very young dogs. Pit bulls and Rottweilers and Dobermans seem to be more susceptible to parvo than just about any other breed, but literally any breed can get parvovirus. These dogs are really, really sick. They need to be hospitalized on intravenous fluids while their body gets rid of this virus. This virus actually didn't show up until the 1970s. We do have a vaccine for it now, so it's less of a problem, but you do still see it, and these poor little dogs are very sick. Kennel cough, also known as infectious tracheobronchitis, is a really common disease of dogs. It can be a bacterial disease. The bacteria is called Bordetella. It can also have a viral component to it. Um, One of the things to note is that this is a highly contagious but not fatal upper respiratory problem. It's kind of like a dog having a cold. Should be a T. It's kind of like a dog having a cold, but it spreads when dogs come in contact with other dogs, which is the reason it's often called kennel cough. If your dog goes to a boarding kennel when you're on vacation, when you take your dog to the groomer, when you take your dog to the dog park, if one dog's coughing, it's possible that it can spread that cough to other dogs, which is why if a dog shows signs of kennel cough, you have to do a little social distancing and keep that dog at home. Lyme's disease, huge problem, for humans and for dogs. Not so much for cats. Lyme's disease is caused by a bacteria that is carried in tick saliva. And so being bitten by the tick that passes the bacteria is the ultimate cause of Lyme's disease. What we see with these dogs is that they're very lethargic. They usually have a fever and they're painful in multiple joints. Lyme's disease can progress to kidney failure, heart failure, can create nervous system signs. Let's see, will it recognize? Absolutely. Um, there is a vaccine. It's usually two vaccines, 1 month apart, and then annually. After that, the disease itself gets treated with antibiotics, but it's very long-term antibiotics, often a month or more of antibiotics. There is a preventative vaccine that has some protectiveness. I'm not a huge proponent of telling people that this vaccine will prevent Lyme's disease 100% because I have anecdotally seen dogs that are vaccinated still get Lyme's disease, but it will tend to give them a less severe signs of this disease. There's actually a newer emerging disease in the dog world called canine influenza, the dog flu. It is not a coronavirus, it's an influenza virus, and like kennel cough, is highly contagious and spread by contact with other dogs. It creates a pretty severe respiratory infection that often needs to be treated with medications to help the dogs breathe. and sometimes antibiotics. It is worth getting checked out if your dog develops a severe cough. Now, in terms of our friend the coronavirus, we have seen incidences of COVID-19 showing up in the cats of people who have COVID-19. There were a few reported incidents of COVID-19 showing up in lions and tigers in a zoo. However, there is no indication at this point that dogs will get COVID-19, although there have been a few cases of isolating virus from dogs that live in households where someone has COVID-19. So the recommendation is, if you know that you have this virus, this is not a time to do a lot of snuggling with your dog. But at least so far, we are not seeing any evidence of dogs getting sick from COVID-19.